Hi everyone and welcome back to Sports Massage Therapy Education. Today we're diving into the world of trigger points, a key concept in sports massage. So sit back, relax as we explore how to locate, understand and treat trigger points effectively. So the first thing we need to understand is what a trigger point is. So a trigger point is a tight, hyper-irritable spot within a muscle. They often feel like small knots and can cause referred pain, which is pain that is felt in a different area than the trigger point itself. So think of them as the muscle's way of saying something is not quite right here. So how do they form? Well, they usually develop due to overuse, poor posture, or even emotional stress. So when a muscle is under constant tension, it struggles to relax fully, and that's when trigger points can form. So how do we find one? Well, when palpating a muscle, trigger points often feel like small, tender nodules, so we need to press gently but firmly. You're looking for a spot that's not only tender to touch, but might also recreate the referred pain the client has been experiencing. Once you have found this spot, we can then go on to looking at how we actually treat a trigger point, and that's going to involve going through something called a 10-second test first, which is something we use to work out if a trigger point is going to be effective, and then we're going to look at the two different methods on which you can perform a trigger point.
Okay, so when it comes to actually tackling a knot, the first thing that we're actually going to need to do is ensure that a trigger point is actually going to be effective on that area. The way we do that is with something called a 10-second test. And what that means is we're going to effectively trial run a trigger point for 10 seconds. We have to use that pain scale of 1 to 10. We want to get it to a 7. As soon as we hit that 7, we're going to hold it on that area for 10 seconds. And we need to see if that pain goes down. If the pain goes down, that's a good indication that the actual trigger point is going to be effective. If the pain doesn't change, we need to go back to warming the area up a bit more, maybe doing a little bit more stripping through there. So I'm going to demonstrate now how we do that 10-second test. So the client has reported that they're getting pain around here and there's a tender spot. So as I kind of run through here, can you just let me know when you feel the tenderness? Yeah, you can feel that actually. So what we're going to do is we're going to do that 10-second test. So can you just let me know when this reaches a 7 out of 10? And all we're going to do, either 2 fingers, you can use your thumb, whatever you can kind of pinpoint that area with most efficiently. So how was that out of 10?
Probably about 6.
How about now?
Yep, 7.
Okay, so we're on that 7. So we're going to go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. How's that pain?
Probably about 6.
Okay, so it's gone down a little bit, not enough for my kind of a level of comfort. So what we're going to do is we're going to strip that area a little bit. Okay, so we're going to go back in with another 10-second test here, just there, yeah? Let me know when this gets to a 7, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Where are we at 10?
4.
Okay, perfect. So that shows that a trigger point is now going to be effective. So what we're going to do is we're going to talk through the 2 different methods of performing a trigger point. So now we know that a trigger point is going to be effective in this area. What I'm going to do is, same as we did with that 10-second test, I'm going to apply the pressure directly on that. But what we're going to do is we're going to hold that and maintain it for longer than 10 seconds, or as long as it takes for it to get down to, say, anywhere kind of like sub 4. So let me know when this gets to a 7, please.
7.
Okay. So what we're going to do now is I'm just going to continue to hold this. Ideally, the kind of numbers I'm looking for is anything kind of around a 2 or a 3. We want that pain to kind of like completely go down. So where are we currently at now? 5. Okay, so it's going down, which is good. So we know the trigger point is starting to work. I felt that kind of give a little bit then. Where are we at now?
About 4.
About a 4, 3. Okay, I'm going to hold just a little bit longer. How about now? Okay, so we're now at a 2, but instead of taking the pressure off, what I'm going to do is apply more pressure and get it back to a 7. So let me know when this gets to a 7 again. Okay, you can see for me, I'm just using that other finger just to reinforce that pressure. Okay, where are we currently at? 5, good. Usually what you'll notice is when you start going a little bit deeper, that pain will start to ease off a little bit quicker than that first attempt. Where are we currently at now?
2.
Sorry? A 2, perfect. So again, one more time, I'm going to go back to a 7. So a bit more pressure now, let me know. Okay. And I tend to only do this around 3 times. Okay, where are we currently at? 5, perfect. I'm going to keep going again until we get around about 3 or a 2. Okay, where are we currently at? 3. Perfect. And then what I'm going to do now is just effleurage that area. And that's method 1 of performing a trigger point. Okay, we're going to look at method 2 now of performing a trigger point. So naturally I'm going to do a different area because just over here, this is actually eased off quite considerably. So we don't really want to go and do anything more than we need to. We don't want to irritate that area. So the client has reported another one just around here, which I can feel. So method 2, in fact, first thing you would do always is you would do your 10-second test again on this area just to make sure. I've already performed that and we know a trigger point is going to be effective here. But anytime you're going for a new area, always perform that 10-second first. So method 2, so if you just let me know when this gets to a 7, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to immediately ease off for about 2 to 3 seconds and then back on again. Let me know when this gets to a 7, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Easing off again. 2 to 3 seconds, back on. Let me know when this is a 7, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Easing off. You can do this for pretty much up to around 2 minutes. Let me know this is a 7. Okay, the fact that we're struggling to get it to that point shows that it may have actually given up a little bit. Let me know when we get back to a 7. I'm going to have to apply more pressure now. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And again, you're just going to repeat that for as long as you feel necessary. But the thing you'll notice is every time you're going to have to go a little bit harder and apply more pressure because it's becoming harder to get it to a 7, showing that the muscle, that adhesion, that area of it, like the issue, is starting to give up and it's starting to relax.
And always remember, after every session, encourage your clients to stay hydrated. And yes, for you eagle-eyed viewers out there, that is a Pokemon t-shirt. And just like Not, we've got to catch them all. But in all seriousness, always remember to perform your stretches. Make sure that the client stays hydrated to help flush out any toxins that have been released during that massage, which is going to reduce the likelihood of those trigger points reforming. And that is a wrap on trigger points. So I hope this video has helped you feel more confident in identifying and treating those pesky knots. As always, don't forget to like, comment and subscribe for more sports massage tips and techniques. And until next time, stay relaxed and keep learning.